Okay.
Turn on the microphone.
Recording in progress.
Okay, being 5:30 p.m. on September 24th, 2025, I'll call to order the Town of Bourne Board of Health meeting. It's a public meeting notice. This meeting will also be televised on Zoom. The Zoom chat will not be monitored. Participants who wish to speak must raise the hand icon until the chair asks them to unmute. Note this meeting is being televised and recorded by Bourne Community TV for replay. If anyone in the audience is also recording or videotaping, they need to acknowledge such at this time. All items within the meeting agenda. Okay. And you. Okay, thank you. All items within the meeting agenda are subject to deliberation and votes by the Board of Health. If anyone from the public wishes to access the meeting remotely, they can do so by clicking the Zoom link or by calling the following conference line on their phone and using the Zoom meeting ID and password below. The dial-in is 309-205-3325. Zoom meeting ID is 848-0862-6866, and the password is 897944. The first item on the agenda is attendance. Dusty Meyer.
Here.
Margaret Reale.
Here.
Bob Collette here. Miguel Prieto is absent, as is Donald Ellis. Number 2, review the calendar of anticipated Board of Health meeting dates for 2026. So Caitlin provided a calendar for us. And I want to say that there's a chance that I may not be able to make the October 14th meeting.
Of next year?
Oh, it's next. I'm sorry, it's next year. I'm
Then,
talking
okay.
this year. Sorry, right. The 14th this year is a Tuesday.
All right, I'll be
Sorry, next
studying.
year. Any questions about that?
I'll start working on that
Oh,
right now.
No, the 14th I think is a Tuesday. I'm sorry. It's for this year, but
Okay. Well, thank you for letting us know.
This means nothing.
this was,
I mean, this looks
Right.
like,
Yep, just
Always.
some tentative
No
dates that we
changes.
can have, so people know that this is dates that they can submit for, just to have that scheduled.
right, yeah, no, that's good, thank you.
Yeah, I
Second and
appreciate
fourth,
that.
we'll try to be there, every one.
yeah. I like the format too. It's nice,
Oh, yeah,
easy to read.
yes.
Any questions or comments on that?
Nope.
Okay.
I move to accept this schedule of meetings, this calendar for 2026.
Second.
Okay. And I'll agree. Yes. So, I'll sit on that. Okay, number 6, Massasoit Ave, continued from September 10th, 2025. John J. Briscoe and Rhonda L. Briscoe, trustees. Failure to upgrade failed septic system per 310 CMR 15.000, Title 5. Okay.
Good
Caitlin?
evening, Chuck Rowland.
Oh, there he is.
Hear me all right?
Yes.
Yes.
I'm representing Mr. Briscoe, and as discussed at the last hearing, I got in touch with him. Yes, he does stay on there on occasion, and I let him know that that might not go over well, but we, in honesty with the board, we are letting you know that on occasion people are staying there. And he does plan on construction of replacing the septic in the next couple of months. You can F. Brothers, Brett Ellis, and then I also wanted to add in that as of recently, to my knowledge, and maybe the staff can confirm this, hopefully they can confirm it, so I don't like being told things that are not true, but I believe that we have applied for a septic permit. Additionally, my office has sent in the deed restriction for the required 2-bedroom deed restriction as part of the approved septic design that this board approved. And so we have that, and we just need to get that
Yes, we have.
signed in front of a notary and recorded. So we are working towards his permit. So I just want to make sure that you guys are aware that we are moving forward, and we haven't been sitting on our hands since this has been brought up.
Okay. Thank you. Any questions, comments from the board?
When do they expect the permit to be finalized?
So yes, I can confirm over the last 2 weeks since we had the last meeting, we have received several of the required documents. At this time, we're just awaiting the recorded 2-bedroom deed restriction. We haven't received that recorded copy yet. Once we have that, the application is complete. The board did approve the septic design plan back in 2024. So I would just review and make sure that there's no other concerns and make any notes about required inspections, and then it could be issued. So I would say, less than a week we could have that permit issued.
Okay,
So there is progress.
yeah,
Yeah.
so you're saying some of the documents have been submitted that are needed, so we've already started the process of the septic package is, okay, so we just need to get the rest of them done. And since last time, Mr. Volland said that they could go ahead and, without the building plans being completed, they can go ahead and do the septic. I think we should just set a deadline to get everything in. I mean, the whole package done, so that they have a deadline to work toward and help to give you an incentive to get this done, get it finished. What do you think?
Sure. Yeah, I agree. Yeah.
Yeah, I did, I just picked up the staff turned it around very, very quickly, so we prepared the documents, we sent it in, staff signed it, and I picked it up when I was out doing field visits yesterday, and so we've been in touch with the client, so we just have to arrange a time for him to come in while our notary public is in the office. I'll actually be out on medical leave next week, but so I'd appreciate it if we had a little bit of time, just because of being able to coordinate people. But I think that we would agree to all that.
I'd like to suggest if we could have the completed septic permit application submitted, everything by October 8th, and then by December 31st, to have the system fully installed, inspected by the health department, and a startup letter received from wastewater treatment services.
Could you put a stipulation in there that, or have the house not be occupied?
Based
I
on,
just wouldn't like this. Based on timing. If something were to come up, I don't want to see. I mean, I don't disagree with any of your timelines. They're very tight, and so everything has to be coordinated very quickly, which is fine. But if something were to happen, I would hate to see us to get repercussions for something that might not be totally in our control. So the alternative would be to say that the house cannot be occupied if something were to not hit those timelines.
We want to make sure, though, that we get this done, in the 2-year time period, so,
Sure.
so we don't have to get, go out. So that's why we're wanting to move along.
Okay.
So we have to, because the variances have been approved. So anyway, what do you think about just extending it like 2 more, like 2 more weeks? Like, in other words, instead of October 8th, the end of October, to have the complete package, and then
Perfect.
another, maybe the end of January to have it done. I don't know if that's reasonable
I think
because
that's a
of
little
weather.
bit. I think that's a little more feasible. We greatly appreciate it. Thank you.
Well, I'm just suggesting, what do you think?
So, I mean, if that's what the board's comfortable with and that's something you guys are okay with, seeing how you're not asking for the completed installation until the end of December. But with it just being, we're missing one thing, which is the recorded copy of the deed restriction that we've already signed.
Okay.
It shouldn't be that hard to coordinate an email of a copy to our office.
Okay, so there's only one thing that you need.
Yep.
Okay,
Right.
what do you think, Mr. Rollins? You think you can do that in 2 weeks?
You know, heaven forbid anything were to happen while on the operating table. I'm hoping I can do that, but we shall see. I'm just out on medical leave next week, so it's just, I want to make sure I have time to coordinate everybody, but that doesn't mean it can't get done without, in my absence, so I can always pass something like that along.
Okay. All right, so if you get the package in by October 8th, then what about December 31st? Get the whole installation all done by December 31st.
I can't really speak to that. I'm not really an installer, but whatever the board feels comfortable doing, we will do our best to meet those deadlines.
Okay.
Yeah, I think that sounds reasonable, and if, you know, some extenuating circumstance arises, and, you know, that could be addressed at a later date, but I would like to see December 31st myself.
Okay.
Dusty, did you have any?
Have the people been notified of the fines if these conditions aren't met?
That would be something you guys would vote on tonight if you wanted to instill fines, yes. And then a letter would be sent to the homeowners explaining that.
Okay.
I'm willing to let the first set, the October 8th go, but the final, inspected, all complete, I think that date should stay. I'm very concerned, this has been going on 10 years.
Okay, yep.
Yeah.
And
Okay.
I can't understand how that happened, but
And as Caitlin pointed out, October 8th, there's only one thing they have left to submit, and then the whole package will be done. So I think keep October 8th then. I didn't realize I didn't catch that it was just one thing left at first when I suggested extending that. So we can do it October 8th. But what do you guys feel about imposing fines? If
if
there are
they
those.
complete the first phase of this, I feel we'll let it go, but not the second phase,
Okay,
which is the complete install.
okay. All right.
So, in other words, if the December 31st deadline is missed, a fine of $100 each day of noncompliance would constitute a separate violation each day. You know, each day would constitute a separate violation, so it'd be $100 a day for each
Okay.
day beyond December 31st.
Okay.
And, you know, in addition to that, the potential further enforcement actions for the Board of Health could take are legal action as the owner has failed to adhere to the Board of Health requirements and orders, or to find the dwelling unfit for human habitation as a condition deemed to endanger or materially impair the health or safety as set forth in 105 CMR 410.630, the State Housing Code. This has existed for over 10 years. Failure to provide a toilet, sink, shower, or bathtub, and maintain a sewage disposal system in operable condition required by 105 CMR 410.110A and B and 105 CMR 410.130B. Since the violation has existed for over 10 years, the board has concluded that other legal remedies cannot be reasonably expected to bring about the removal of the condition with sufficient speed to prevent serious harm or injury to occupants or to the public. So the board could take either of those actions, or, you know, any number of those included in that, potentially.
So I can go ahead and read the motion, but I'm going to transfer the penalties, the $100 fine, to the going over the December 31st date rather than the October 8th date. Does that sound reasonable? Okay. So I will read it. So I move that the Board of Health set the following deadlines and enforcement for the 6 Massasoit Avenue septic system. The complete septic permit application must be submitted to the Health Department by October 8th, 2025. The septic system must be fully installed, inspected by the Health Department, and a start-up letter received from Wastewater Treatment Services Incorporated by December 31st, 2025. So failure to meet that deadline will result in a $100 fine with each additional day of noncompliance, constituting a separate violation and incurring an additional $100 per day. And also failure to meet this deadline will bring the matter before the first Board of Health meeting in 2026, which would be January 14th, 2026, for consideration of further enforcement and penalties. Do I need to read 3? The Health Department?
If that's a statute that you want to include in your motion, yeah. Do you want the health department to be able to issue fines if this is not met on December 31st?
Yes, the Health Department is authorized to enforce all applicable regulations, including fines and penalties, to ensure compliance with these deadlines. That's my motion.
I'll second it.
Okay. Aye, yes. Motion passes unanimously. Thank you, sir. Any
Thank you. I'll let my client know, and we'll get this moved along. I appreciate your time. Thank you.
Okay,
Good luck
thanks.
with your surgery.
Yes, good luck.
Everything turns
Yes.
out all right.
Me too. I think it shouldn't be, but have a great night. Thank you.
Okay, thank you. Okay. So, next agenda item is the public hearing to propose updated Bourne Board of Health regulations regarding the 150-foot setback distance from the soil absorption system to resource areas pursuant to MGL Chapter 111, Section 31. Regulation to combine 150-foot setback and hydrogeologic study regulations continued from September 10th, 2025. We'll now reopen the continued public hearing of the Bourne Board of Health regarding the proposed 150-foot setback regulation. This hearing was originally opened on September 10th, 2025. At that time, the public comment portion of the hearing was closed. The board voted to continue the hearing to this meeting to allow for edits and further review of the proposed regulations. As the public comment portion is already closed, no additional public testimony will be taken this evening. Tonight's discussion will be limited to review of the revised draft language and board deliberation. Okay, so Caitlin, can you summarize the
Yes.
changes that have been made?
So based off of what you guys discussed at the last hearing, we changed the wording in section 1B, relating to who can submit a hydrogeologic study. So that was the suggested language from Dawn, that you guys wish to include instead of specifically calling out a hydrogeologist. We also added additions to the definition section, section 2, to include in 2B, monitoring wells as an approved way to determine highest groundwater. And under 2E, to include an exemption for non-eroding coastal banks and floodplain areas from the wetland definition for the purposes of this regulation.
Okay. Everybody get a chance to look at that? They are the changes that we asked for Caitlin to incorporate into the regulation that we've been considering. Any questions or comments on the changes that have been made? Amendments?
good. They look,
Yeah,
they're in compliance with what was discussed.
okay. All right. So,
I would just recommend too that if you guys choose to move forward with adopting the regulations tonight,
Yes.
that in a motion you include an
The
effective
date,
date.
and,
Yeah.
and that's right, we were gonna discuss.
Which can be,
what
could
would
be,
be a good-
could be tomorrow, could be a week from now, it doesn't matter.
It doesn't matter.
Nope, it's just whatever you guys feel is appropriate.
Because I was going to ask what, you know, what the typically is when you do updates with regulations, how soon you make them effective? What date would we want to?
I mainly look at how much work is this gonna put on you people if we approve this for, in 1 week, say 1 week? Does it put more work on your office?
Nope, we just basically post these officially and submit it to the state, so it's not too hard. And then we post the next time we run what was approved, what was changed in the newspaper. So it's not any additional work. Words are escaping my brain, sorry. Whether it's, today, tomorrow, next week, next month, it's the same amount of work.
Yeah.
So, yeah.
And it wouldn't affect any applications
That are currently in
currently
existence?
in motion right now?
Nope,
Yeah.
I don't believe so, no.
Right.
How about October 1st? A nice
I think that's
even
great.
number, is
Yeah.
that?
Yeah. Sure.
You want to read the motion? You want me to? It's up to you. I can do it if you want. I got it, because I marked it, but I just didn't know if you wanted to.
No.
You don't? Okay.
No, I never want to.
Okay, okay. All right, just don't want to hog the motions.
Make sure to.
All right, I move that the Board of Health adopt the proposed 150-foot setback regulation as revised and presented at this continued public hearing, effective October 1st, 2025, and further rescind the existing Board of Health hydrogeologic study regulation, as its provisions are now incorporated into the 150-foot setback regulation.
Okay. The motion's been made and seconded. Are there any discussions? Is there any discussion?
No.
Hearing none, we'll proceed to a vote.
It does need to be a roll call vote.
Okay? Dusty
Yes.
Meyer? Yes. Margaret Riale?
Yes.
Bob Collette, yes. Motion passes. Board of Health has voted to adopt the 150-foot setback regulation and rescind the hydrogeologic study regulation. This concludes the continued public hearing on this matter. The hearing is now closed. Okay. Thank you. All right. Number 5, any public comment on non-agenda items? Seeing nobody in the room. Anyone on Zoom from the public?
I think they left us.
Okay. Hearing none. We'll move on to number 6, Health Director's Report.
Great.
If you have
So,
anything.
just an update that we will be hosting our annual vaccine clinic on November 19th from 9 to 12
Yay.
at the community building here in room 1, which is across the way over there. So at this clinic, we'll be offering COVID-19 vaccines for ages 12 years and older, and flu vaccines for ages 6 months and older, and high-dose flu vaccines will be available for people 65 years and older. Pre-registration is required via the link that is on the flyer that was in your packet and will be posted to our website. If anyone needs assistance with registration, they can call the health department, and we will help them through that process. Yeah.
Fantastic. Thank you. Okay. Anything else?
Nothing from us right now, I don't think. No.
Okay, wonderful. On to number 7, any comments from the board regarding future agenda items at this time? No? Okay, hearing none. We might set yet another new record.
Since you've come, Bob, it's been nice.
I could think of something.
Losing people here.
Oh, shoot me.
We like to be succinct and concise and direct and get it done. Right? I'll entertain a motion to adjourn.
No, I want to stay.
You must
I
have
make a
seen
motion
chit-chat.
to adjourn.
I second that motion.
Okay, and yes. Okay, thank you very much. I didn't even get to open my water bottle.
Recording stopped.
All right, thank you very much, everybody. All right, so I'll do it now.
I just keep
I just acknowledged that Dion was like, I can hear you.
Katie, thank you for putting it together.
Yes.